The other point I want to make that brought up that we still see the disparities in blacks and whites. As we know, incidents with recent report came out that we still see the black-white difference in disability-adjusted life years across all states. And actually, some states are 25 years behind others in that disparity. And the data coming out from the burden disease study. The last thing is a question about interventions. Back in the day, sort of the early years post Evans County, was there discussions about doing interventions in Evans County? What was the thought then?
Well, there were some interventions that, we used to, well, not we, but randomized communities. Did they spring out of the old Monica study? I know that Stanford was involved, but I think they all crashed and burned.
But I was wondering, did they ever try to do something in Evans County?
Oh.
You guys did intervention.
I can only hear half of what you're saying.
So I was just wondering if there ever was a conversation about the next, Evans County 2, or whatever would come next. Would there be an intervention study?
That's a very good, interesting observation. I mean, other people were doing that. Stanford, 3 communities, 5 communities, Minneapolis, and so on. Nothing like that was done in Evans County, to my knowledge. Also remember, John Castle got sick and died. The core of the department's faculty was not, I think, as strong as other departments were still growing. But you're right, it's not a theme that I've seen.
I don't know that I have anything specifically on that, but of course the logistics of working in Evans County as you move into the more modern era where people are trying to do things faster and it's not as convenient to get there and so on. Might have had something to do with it. I think there was an HDFP site there or something.
I'm sorry.
I think there was at least some other study, and there was a freezer accident, as I recall, and lost a lot of specimens, and that wouldn't have helped.
I had a question about interventions. So I don't do any interventional research, but to me it seems like part of the issue might be funding and scale. So like if I think of an intervention, I would say it's not necessarily an experimental intervention, but like adding bike lanes, for instance, has become a big deal in a lot of wealthier urban, suburban areas. But you don't want to not offer, you don't want to say like you guys are assigned bike lanes and you don't get it in your city if they have funding to do it. So what kind of, on that kind of scale, when it costs so much money to implement these things that we expect will have very big benefits. How would you design an intervention in that setting?
I'm certainly not an expert, but I think you bring up a very good point. The complexity of these interventions at cost, at the same time, these changes we are witnessing in society. In some places more so than others, and so several investigators have taken the opportunity, have jumped at the opportunities of observing with natural experiments where where groups of individuals introduce these changes. You mentioned affluent and more affluent settings, perhaps things happen, but you can do it before and after. The transportation systems were introduced on the West Coast in several segments, and people put them before and after. Walkability has been increased, etc. So one need not develop infrastructure, to do that, but we should need to know whether the infrastructure has a beneficial effect under such circumstances. So yes, more complex, but I'm admittedly a little bit jaded by now, because having seen years of observational research, great papers, I'm losing a little patience about doing more observational research, write more papers, but there has to be a reason for doing it.
Well, Gerardo, the cardiovascular intervention studies that have taken place, as you know, have been large, if not national. You had things like the Stanford study where they studied several communities and then 5 communities with mass media. But you need, with an outcome like cardiovascular disease, to see changes, you need a pretty large population in any site. And I think that makes it hard to do something in Evans County and, of course, anywhere. And then you have the big studies like HDFP and Mr. Fit and so on. And Mr. Fit, millions, $100 million, and then they didn't have any real demonstration. So it's really difficult to do studies like that. which isn't to say that one couldn't have done a lot of valuable interventions in Evans County, and I hope Curtis Ames was able to introduce things into his practice in the preventive area. I might add a few things to your excellent presentation, which is really exciting for me. I first took cardiovascular disease epidemiology in 1978 from Gerardo and Al Tyroller, and I guess Ed Davis would have been the third faculty in the course. So this is very exciting to me to see that I can still hear Gerardo explaining cardiovascular disease to me, and with now the benefit of decades of additional experience. You mentioned that everything was done with stratified analysis in Evans County. But of course, when I was here in the late 70s, by then we were doing logistic regression, and Evans County data was being used to illustrate it, and I think the papers that were coming out then. So even though the primary studies took place, were published in that volume in 1971 in Archives of Internal Medicine, I sent Gerardo some slides which had lists of the studies. It took 3 slides. I used the smallest font size 7, so you couldn't even see them, but they filled 3 slides with the papers that have come from Evans County. And of course, many of those were done with mathematical modeling. And there was also effect modification being studied in that, and I'll tell you an amusing story about that. So I was a TA for Epi 268, which is now 715, the advanced methods. And David Kleinbaum was teaching it, and the style for the final exam was there would be a data set, and the data set would then have the TAs would work out the analyses, and then there would be questions for the students. Alice, I don't know if you took it that year.
I didn't take it that year, but a little later.
You were lucky. So I think this would have been probably spring of 78, probably spring of 78, maybe spring of 80, of 79 or 80. So I was one of the TAs, and we took the Evans County data because I'd seen the study by Lisa Berkman and Len Syme on social ties and mortality. And I thought, well, gee, we could do that in the Evans County study. So we got a data set pretty hastily, and I did the analyses, and there was this social status, social class variable, McGuire-White, kind of unusual one, and the coding wasn't obvious to me, and I just figured, well, it's got these 2 dimensions, I'll just add them together and use that, and I did, and there was this fascinating effect modification with social class. And of course, for the exam, that was just what we wanted, because of course, Dave Kleinbaum and Larry Cooper were teaching about effect modification. So we did that, and the exam went very well and everything. And then later, Dave Kleinbaum was going to give a lecture at American Public Health Association, and he decided to use this as his example of how to do these multivariable techniques. So he said, Vic, could you just check over what you did? Because now I'm going to be presenting this to a national audience. So I thought, well, I guess I better find out about this social class index and how you really use it. So I got in touch with, I don't know, it might have been your wife, I can't remember now, or Marilyn Knowles, one of the people who was working with the Evans County data, and she sent me the documentation, and I had completely destroyed the variable. So I then redid it. I was really grateful that it was happened in time, and I hope this wasn't going to destroy Dave Kleinbaum's beautiful teaching example for APHA. Turned out there was another interaction, but it was in the opposite direction. And Larry Cooper, who was teaching 268, loved that. Because he was very critical of social epidemiology. And he said, it just confirms my understanding of social epidemiology. You get one result, and you can understand it and interpret it, and you get the exact opposite thing, and you have an explanation for that too. So that's my funny story. And then several years later, I did a study with Bert Kaplan, who was the man who created the social and behavioral questions for the Evans County follow-up on social ties and mortality. We took that example and we said, well, let's see if we can turn it into a paper. And I was very fortunate, that's where I got my first NIH grant to do a replication of the Berkman Syme study with Evans County. So we did that and published it. Dave Kleinbaum was working with us on it. We used proportional hazards regression, one of the first studies I'd ever been involved in with proportional hazards regression, which at the time was somewhat novel. So I'm very grateful to Evans County and Gerardo for giving me some basic understanding of cardiovascular disease epidemiology.
Thank you very much. Any comments or questions? But if you are running out of time, we'll stay around.